Hi, my name is Nicole Simpson, and I'll be talking about alcoholic induced dementia. Over a period of time, alcohol can destroy or severely weaken the brain, causing altered mental status, which would affect decision making, judgment, and nutrition. In some cases, Wernicke Korsakoff syndrome can develop. This syndrome includes both encephalopathy and psychosis. Signs and symptoms of this would include vision changes, confusion, and an unsteady gait. Now, I'm not just speaking of substance abuse, but also mental health, alcoholic induced dementia. Now, without a history and physical from our 54-year-old female patient, we don't know if the alcohol caused the mental health or if she's self medicating to disguise the mental health issues that have already persisted in her life. In any event, she shows up to the hospital with she's disheveled, she's disoriented, she's combative, she's shaking, she's asking for things that aren't normal. We want to make sure that we can calm her down so that we can get a proper assessment and ask some questions that only she can answer. If the combativeness or the uncooperation still persists, then we can ask the doctor to provide antipsychotic medication like lorazepam to help calm her down, reduce the situation, and then we'll be able to get things like lab work, put an IV in, check a CBC, a Chem 14, maybe check her thiamine level, and then try and get urine for a drug detox. Now, we also want to particularly pay attention to the shaking, which is probably withdrawal symptoms. So, we want to make sure we also offer emesis basin or things like that for nausea and vomiting. We also, because she also came in with some bleeding from a fall, we want to make sure that we do some wound care and perhaps get an x ray to make sure that there isn't anything broken. She's probably going to be looking at inpatient treatment either at a psych facility or at the hospital, depending on how severe her diagnosis is. Someone like this, we have to check or figure out what the long term effects and the short term effects for this patient will be. And the short term effects would include GI problems like an ulcer because the alcohol can eat away at the stomach lining. So that would also affect her nutrition. We also want to make sure we clean that wound site really good so we don't have an infection. Also, we want to check on how severe her problems are and see if the short term memory loss has been affected. Also, compliance. Compliance to see if the patient will be able to take the medication upon discharge to help her condition. Long term effects will include also the memory loss and the compliance, but also maybe seizures down the line and liver failure because of the alcohol consumption. If the altered mental status has not shifted with the medication and perhaps some IV fluid, we probably want to look at getting a CT scan and also get a treatment plan together that includes the doctor, the nurse practitioner, a psychiatrist, a psychotherapist, pharmacy, social worker, and case management. Now, I suspect that the patient is homeless due to her presentation, urine, stale body odor, which also signals to me that she may not have any insurance. So this is going to be a big job for the social worker and the case manager. Now, depending on the location of the location of the patient, services may be scarce or plentiful, like urban and rural type of population. We want to get her enrolled in a Medicaid type of program. These programs can include health benefits for mental health and substance abuse disorders, of course, if she qualifies. And that's always another issue is this patient at a point in their life where financially, physically, they just can't do and that they would qualify. The Diagnostic and Statistical Manual of Mental Health Disorders is a manual that is used by the insurance companies to help reimburse hospitals or medical facilities. However, with the rising cost of medication, some of that will have to be placed back onto the patient. And that's just not acceptable. The services is not acceptable. They need more. They need what they would give children, which is everything. As long as they have, their parents and the insurance, they get all of that. So extra services would be like peer support, therapy, medication management, social work services, and also maybe a sliding scale for cost so that we can keep everything affordable for these people to be able to take care of themselves. That would help the situation. And also, finally, a support team. Is there a support team to help this patient? Thank you.